Testing, testing, testing. Hi there, guys. My name is Rohan Beve, and today we are going to be talking about cardiac arrest. Today we're going to be talking about what is cardiac arrest and what causes it. So, you might have heard cardiac arrest from jokes or maybe just heard about it from somewhere else, okay? Now, most people confuse cardiac arrests with a heart attack and think it's some kind of heart attack, but it is not. It is very much different. But first of all, what is cardiac arrest in the first place? Well, so let's say we put up the example. Let's say you're just talking with one of your friends, okay? And then all of a sudden they just collapse. They just collapse, okay? And they stop responding. Now, one cause could be cardiac arrest, okay? Which is mostly mistaken for heart attacks. And the thing is, heart attacks, what happens with them is that blood does not reach to the heart, okay? Mostly because it's blocked by clots of fat, okay? That's what a heart attack is. But cardiac arrest is a bit different, okay? What cardiac arrest is basically when the heart stops pumping blood properly. It just can't pump enough blood, hence not enough oxygen goes around to all the organs and the organs start dying. Okay? That's what cardiac arrest is. But for a little bit of in-depthness on to it, okay? What happens is that our heart, okay, sends in these electrical signals, okay, and these electrical signals, this rhythm, okay, keeps the heart pumping. But when it's messed up, full chaos goes around, okay. Now, eventually, due to this, it basically malfunctions and it starts to get irregular, okay. Now, some causes of cardiac arrest can include, for example, heart disease, electrical disorders, or just even a good sucker punch to the chest super hard where the heart is can mess up the electrical signals and basically create everything into chaos, okay? And basically the heart can't pump blood anymore. For example, sometimes in the lower chambers, the blood can't get out properly, hence being stuck, hence the heart, can't, yeah, it's basically just shuts down. And the thing is, the scary part about it is that the thing about it is that it's very quick, okay? Like super quick, okay? For one moment you're just chilling around, right? But then all of a sudden, slow things start to happen, okay? And early signs of cardiac arrest can occur, such as what you say, like this filtering in the heart, or not in the heart, but in the chest, okay? This weird sensation in your chest. You might start to feel a bit dizzy, and you might start to get tired for no reason at all. Then, all of a sudden, when the actual symptoms of cardiac arrest occur, you all of a sudden collapse to the ground and you cannot respond, okay? Your skin starts to turn to this dull and bluish tone, and you basically have an irregular pulse. So if you see anyone that has all of these symptoms and you suspect it's cardiac arrest, what should you do? First of all, call help and call for emergency services immediately, okay? Okay? And the second thing you should do is immediately do CPR, okay? So you have to do 100 to 120 beats per minute, okay? Chest compressions. So you basically want to continue to CPR, okay, on the person. And if possible, if there is an AED, okay, use it, okay, which is basically a disruptor. So, not disruptor, but defibrillator. Yeah, sorry. It's basically a defibrillator, an automated defibrillator that basically shocks the heart and attempts to reset the signal, to reset the flow of it, okay? And then wait until emergency services come over, take them to the hospital, and make sure everything gets checked out. Now, we have to do all of this super quick because any delay can lessen the chances of survival. Okay, so we have to do all of this very quickly. And if so, our chances, the person who has cardiac arrest has chances of survival and can possibly survive. Okay, but that's basically what cardiac arrest is, and that's basically it. Thank you for watching this video. Hope to see you next time. Bye bye.